In this video, we're taking a look at the difference between cholecystitis and cholangitis. They're both diseases that affects the gallbladder. Let's first take a look at cholecystitis. Here we have an inflammation in the entire gallbladder. And when we look at cholangitis, then there's an obstruction in the bile duct that then traps bacteria inside of it, and it causes a infection and inflammation in the bile duct. Now back to cholecystitis. The symptoms that are usually associated with cholecystitis is pain under the right rib cage, especially when compressed, and this is what's called a positive Murphy's sign. Fever can also be a common symptom of cholecystitis. Now moving on to diagnosis and treatment. And remember that this can vary from country to country and hospital to hospital, so it's best to look up how it works in your location. However, usually ultrasound aids in the diagnosis of cholecystitis, and then there's usually a gallbladder cystectomy to treat it. Now let's get back to cholangitis, where we had the inflammation in the bile ducts. The symptoms here is Charcot's triad, and it consists of fever, pain in the upper right quadrant, and jaundice, or yellowing of the skin and eyeballs. And here as well, ultrasound can help with the diagnosis, and then you would usually do an ERCP to remove the obstruction, and then antibiotics to treat the infection. And that covers everything for this video. I hope you learned something.